Hello, welcome back once again to my YouTube channel. I'm Dr. Momungla, homeopathic doctor, and today I'll be sharing on UTI, also known as urinary tract infection. But before going into this UTI, let us learn what are the components of urinary system. Amigan, yadi kunubaba comment section di hotianishna UTI urine infection kuidagina itula ulup chani buli mona si korba mo yadi katak dabra share kribo. Urinary tract infection itu di najadam day. First of all, urinary system the kiki say itu first. Urinary system composed of our left and right kidney, aro ureters, bladder, urethra. Itu kan component, itu kan organ milai kina urinary system benai. So if there's any infection in any of these organs, we call it as UTI. Nah? Okay, so what causes UTI? Urine infection to kibra olaide. It was say there are many bacteria. Nah? Bacteria the most common of them is E. coli. E. coli kuna bacteria does say like 80 to 90% urine infection though itu bacteria par olaide. Okay. Now, what are the types of UTI? Urinary tract infection be type 2 say. First is lower urinary tract infection and upper urinary tract infection. Mukan kita itu sabo urinary laga picture to say shigulido kidney upper urinary tract infection is composed of kidney to say or itu ureters. Kita itu kidney and ureter. If there's any infection na itu tuita machudi itu ki pyelonephritis we medical term di aro upper urinary tract infection do itu tuita laga involvement as infection aro lower urinary tract infection do kiki asigulito mona bladder na bladder aro urethra itu tuita kide infection hobo itu ki lower urinary tract infection inakabikoy. So upper and lower aro itu tuita machudi the most common is the lower urinary tract na itu bladder aro urethra la infection do lower urinary tract itu laga infection do most common na say will be man severe than hoy itu tuita na aro when organ wise jashiguli kita mukan urethra subsinichi wala organ do itu kita infection hobo itu ki urethritis bikoy aro kita bladder ikla infection hobo we call it as cystitis. Acha, what are the signs and symptoms of UTI? Na apni urine infection asi kuna kinaka chanibo koilido firstly apni pisap kuratamde chuli gina hebuna burning sensation when you urinate itikta se aro next to say frequent urging to urinate na ite jagina pisap kurina aishe will be aro you feel can aro pisap like na jagina kuri bed palbra na jay ulup drop jay kuna badana jagina aibo aro laki boina na urge to pishi take ina shigluda apni UTI ase itu hi no hoy hulibe kunuba do ito lower abdomen falina pelvis fali pishi pikai mohana urine to kideba do pisap chedamdi kun bi ulaina chaina kideba bloody urine there's some blood into urine no libe olop ki kobo mohana urine to clear no higina olop cloudy urine na olop thick ni na olop flow bi palba normal kuran na chaito urine infection dagile itu kan hobo to itu what are the risk factors na inaga urine infection hoto infection dikinar na pishu laiti kulido first of all moi kan itu maiki kan dido because of the anatomy ko ina mogana our structure itu women are more prone akiti ko anishna itu la reason to itaibo kilimani mogan itu whole urinary system di check kushigulido kidney ase ureters ase bladder and urethra ko ina itu kidney do mogan sup chane kidney itu filter ko ina mogan kidney do na amengan body ti thala kun kan water to blood water sup to kidney de safa grobo itu filter kra bishide ki biase kidney de safa krina itu sodium potassium urea creatinine itu kando kidney ra olaido na filter kra bishide olaido itu tela kidney ra olai pina ureters ti chabo ureters pa olai bishide bladder di chabo bladder di bra last day ureters urethra di jaina itu mugan in the form of urine mugan pass out kore. So kitia itu mugan pass out kore do maiki aru mota la anatomy structure do saishibuli do maiki kan la urethra na itu bladder ra chala itu organ do urethra do ulop maiki kan la do shorter than the male. Itu karne the bacteria climb kore infection krubuli bishi females are more common ase kile mani to urethra the structure of urethra in females are shorter than in male itu karni bi itu maiki kan bishi infection kore itu ekta reason ase risk factor do maiki kan bishi wala ase. Now secondly sexual activity na when you have intercourse with your sexual partners and if you don't maintain proper hygiene na itu barabi ekta infection to increase risk factor ekta ulai dia ase aro itu hi nohi kina when you are having like diabetes condition na patient na diabetes patient gando usually you have UTI because mohan itu our itu bladder do barabi the mechanism of urine flow itu bladder the pressure dia karne mohan itu urine to chai to na but then the muscles bladder itu kitia bacteria pishi hoi jabo itu bra when you have diabetes the immune to suppress created because of that itu bacteria has enough room for infection na in the kakrina apni to diabetes thakaba immune suppress created ba itu you are prone to get more UTIs na itu ase pregnancy kida makikan amakan pregnant hoy hormonal changes bishi involve korina itu bravi UTI do olai dibule high chance ase and on top of that uses of catheter kunba do like bedridden patient kando taiga nature jaigina itu hygiene maintain krobo na pare do they use catheter thaling na takakan most often na itu can be infection obole high chances ase aro itu hi noi na menopause time dibe when a woman attends menopause it will be hormonal changes involved vagina that dibe to that dibe infection to olabule high chances ase itu mutakan dibe UTI do mostly like kita age ho male na itu mutakan itu matured hoi higina chedam de 30 plus 40 plus na de prostate species olaina kile mane itu prostate gland to si de lo de ekta antimicrobial fluid ekta si to kita itu tai itu kide ba weak hoi jabo immunosuppressed hoi jabo itu dam de bacteria bra itu control take over krigina itu secretion to comedy hoi jai aru kita prostate to enlarge hoi jai kita tangor hoi jai fully itu dam dibe itu bacteria to kusina itu UTI to olaite done in males prostatitis can be bishi common ase itu karne onian itu ignore no krobo like it may lead to some fatal diseases na kita bodo prostate cancer can be olaite itu karne when you are developing some symptoms starting by to check krobo birth control measures na the way kan aro alag different measures use kore birth control karne itu them de it be urine infection be hoy. So these are some of the risk factors akidik ase mane to septicemia bi hoi jai or shock di jai na it is a very life and death all of risk issue di ahi jai itu karne mohan UTI kan hoitam de itu kidney di jabo bacteria to kidney di pungchi jabo mohan itu sepsis hoi jai septicemic shock hoi jai na kile mane itu organ damage kan bi hoi jabo itu karne bishi careful krobule lage. Okay, now what are the preventive measures na mukha ito causes kan sab learn krishi to ite prevention karne kinaka kunamian ito UTI nulai na takibo ito la kata ba mo kubuli muna si first and most important is stay hydrated pani bishi khabi na ito mukhan body di thaka toxins kan urea creatinine sodium ito kan bishi ulai kidney bra secrete krito ito pal ba wash kunan jabo nemide pani bishi khabo lage stay hydrated which is most important aro pisap lagi damde rukigina alchi lagina pisna I'm very sure because patient can she do report great again like we feel lazy to come out of our comfort zone aro urinate alchi lagi to control kurna thake to bishi biase to bar bishi the bacteria has a chance to travel to your urinary system and get infection. Itu karne kita lagi put chagina apni urinate kurbo lagi hold kuna na rakibina urinate often as possible. When you feel like, do not stop. Ini just urinate na itu ase. So itu be second cause ase. Now you have to again thirdly practice good sexual hygiene. And for all the women, you avoid using irritants na amigan wash we wash conventional washes different itu alag companies different irritants can use karina some like any in the form of creams or perfumes different authors washes can use kari to irritant prabi kita to apni itu urine infection be hoy itu karne itu kan if you're using anything you just stop it if it is irritating your skin. Alright, ito do aming ansop learn ko na siya ito urine infection do kinaka control ko signs and symptom causes ito sup puchi na siya risk factors na to lastly but not the least mukha niya di homeopathy treatment bra kiki tawai bra pal hoy ko dito ito I always say constitutional remedies ko mukha na ito whole pen picture of the patient apni ki sup site na test kan alag rubo urine culture kan sabo urine analysis test kan kura pishide ito bra la result is up there or apni laka ito constitution apni la complaint is up there ito mukha tawai ase aro conditional like urine infection even fever can be uti de ito kani when you're having fever or urine ito signs and symptoms asiguli ito be abni ito check robo lake to ito sub sabi shidi mukan most common simillimum ito tawai to te will be most common often used homeopathy remedies for urine infection kan dase ke cancer risk kuna se dilution dibi pai mata tincture dibi pai na mukan ito dilution dase aro cancer risk policy sarsa barila kuna ito big dase aro ito nishna alag purpuris vulgaris ase so ito consup apni la condition is up to apni la doctor bra they will prescribe the correct amount of dosage na apni acute severe ito la up to ito tipo so ito hin no we have Germany medicines na drops German drops we alag pai ito division alag kasi to inakapal tawai kan ase ito karni late no higina apni do when you are facing all those kuigina ahagan symptoms kan apni lodi ase and you are suffering from this ina securito look chuldi apni ahigina ito doctor lodi pungchide ito pishi relief popo or ito na risk takeshuguli be ito apni chuldi cure krobo ito no even it involves ito amikan convulsion can be hoite kitebo to na pishi severe hoi jali na urine to na amian kitebo do ito convulsion state tak tibi chawuli high chances ase so we should not take very lightly na to ito paratak of ni care krilubi and I hope if you're taking good care of your urinary system of ni to palbra ito julti if you're having problem julti sai shuli to palbra cure kuri chabo ito warning it always says prevention is always better than cure kwanishna aboni bra ito symptoms kan ki kuina shi simple ba kushe ito ulop puchi shi gori to nature ba ulop careful kuna advanced problem ito treat krili bishi bal hobo kuna ito ulop kata video ba share prese thank you.